about hemorrhoid, diagnosis and clinical management, structured framework for classification, diagnosis and evidence-based treatment. What are hemorrhoids? Normal anatomy is basically a fibrovascular cushion in the anal canal present in every person. Fibrovascular cushion, that's a soft connective tissue containing fibrous tissue and vascular structure like arteries, veins in the anal canal in every person that maintain the continence and protect the anal sphincter during defecation. Is basically soft pillow of fibrovascular cushion, fibrovascular connective tissue that maintain continence and protect the anal sphincter during defecation. But when the cushion system become pathologically enlarged or displaced, produce symptoms like pain or bleeding. When the pressure or when there is excessive pressure on this cushion system and pathology that of the cushion system, that elasticity is lost, the protective mechanism of the vascular vessels, veins, arteries lost, excessive pressure that dilate the give pressure to the vascular structure as the veins wall are less strong, less musculature, so it easily veins easily get dilated and ruptured and produce pain and bleeding per rectum. So when the cushion system pathologically enlarged or displaced, then produce symptom pain, bleeding per rectum. Prevalence of the disease 36.4% max prevalence reported in general population studies. Peak age range 45 to 65 years of highest incidence in this age range, that is 45 to 65 years. Hemorrhoids are more prevalent. Key risk factors of hemorrhoids: chronic constipation, straining, pregnancy and pelvic pressure, prolonged sitting and sedentary lifestyle, advanced age and connective tissue laxity. All the factors that give more pressure to the vascular structure of the cushion system, that fibrovascular cushion system present in the anal canal, and when there is a connective tissue laxity, the more pressure under the more pressure, the vascular system become dilated. As you know that veins walls are less thick, less musculature, is easily dilated like a balloon, and the rupture of the veins occur and the bleeding and the pain, all the symptoms of hemorrhoids occur. So what is basically hemorrhoids are basically dilated veins, dilated vascular structure at the anal cushion, the anal canal, because of the increased pressure on it, or there is a connective tissue laxity because of the advanced age or other reason. Diagnostic protocols: if a patient comes to you with complaining of pain in the anal canal and bleeding, fresh bleed in hemorrhoids, as the veins present, vascular structure present in the anal canal, the rupture of the veins produce fresh blood. In case of upper GI bleeding, the blood from the stomach or esophagus or upper small gut, that get time to become alternate, so it gives black color in the stool. As it mixes with the stool, the upper GI bleeds basically altered blood mixed with the stool. But in hemorrhoids, the bleeding occur after the defecation, like a water coming out from the pitch cut in jet action. and is splashes of the blood in the pen. Diagnosis protocols in case a patient comes with a symptom of hemorrhoids, that is anal pain or fresh blood, or just along or just after the defecation, and splashes of the blood, fresh blood, because it's occurred because of the ruptured veins, dilated and dilation of the veins, and rupture and produce the bleeding in case of hemorrhoid. Visual inspection is very important. External exam and anoscopy to assess the anal canal directly. Visual inspection is very important, and digital examination never skip through clinical assessment before treatment. So first, visual inspection, digital examination is very important to make a managed treatment protocol, because you need a good accurate diagnosis, and to make a good treatment protocol in case of hemorrhoids. Red flag endoscopy mandatory if weight loss or anemia. Rule out colorectal cancer first. Any person, especially aged person, come with parectal bleeding, always exclude malignancy before initiating any hemorrhoid management plan. So excluding malignancy is absolutely important in case of parectal bleeding, especially in aged group. What is the classification or grading of the hemorrhoids that help to make a good management protocol, treatment protocol? Because treatment basically depends on the grade of the hemorrhoids, either it is conservative or needs surgical intervention. Grade 1 hemorrhoids, bleeding without prolapse. Hemorrhoid is there inside, that is internal hemorrhoids, but bleeding is there, but the hemorrhoid tissue not prolapse outside, it remain inside the anal canal. Grade 2 hemorrhoid prolapsed but spontaneous reduction, recoil itself inside anal canal. Grade 3 prolapsed hemorrhoid required manual reduction. The hemorrhoid that comes out, it needs required manual reduction, it needs help to go inside. Grade 4 permanent irreducible prolapsed hemorrhoid that remain outside the anal canal, outside the anal sphincter, and irreducible, do not go inside even with the manual help, it always remain outside. Grade determines the appropriate treatment pathway, always match intervention to classification. I mean, the management protocol, what I offered the management treatment in case of hemorrhoid, it basically depends on the grading of the hemorrhoid. Either it is conservative or surgical intervention the patient need. So stage 1, basically hemorrhoid is there but it remain inside, bleeding is there. Stage 2, hemorrhoid prolapse but to recoil, go inside, do not need manual reduction, is go inside automatically. Spontaneous reduction. Stage 3, the hemorrhoidal tissue prolapse and require manual reduction, need digital help to go in to take the hemorrhoid inside the anal canal. Grade 4, that hemorrhoid remain outside and irreducible, it's always remain outside the anal canal, anal sphincter. So that is grading of the hemorrhoids. What is the office-based procedure in case of hemorrhoid? That is not a extensive surgical intervention. It's basically rubber band ligation, sclerotherapy, infrared or electrotherapy. All of this treatment, all of this management, basic principle is that to stop the blood supply to the hemorrhoidal tissue, that so that the hemorrhoid tissue do not get the blood, and the tissue shrunken and the symptom improves. Rubber band ligation. A rubber band is attached to the base of the hemorrhoid, so the blood supply cut off. Sclerotherapy, sclerosing agent injected at the base of the hemorrhoidal tissue to obliterate the blood supply. And infrared or electrotherapy is targeted destruction of the vascular pedicle. Three kind of management, but the basic principle is same. Reduce the blood supply, the feeding vessel that feed the hemorrhoidal tissue, so that the hemorrhoidal tissue shrunken and the patient get better, patient condition improved. Surgical intervention, excisional technique, Milligan Morgan, that open hemorrhoidectomy, gold standard excisional method, wounds left open. Ferguson, closed hemorrhoidectomy, primary suture closure accelerate healing. So basic difference of surgical excision of Milligan Morgan and Ferguson technique is that in open Milligan Morgan technique is open hemorrhoidectomy, gold standard. The wound formed after the excision of the hemorrhoidal tissue left open. But in Ferguson technique, closed hemorrhoidectomy, primary suture closure accelerate the healing. The wound closed with primary suture. Both excisional technique offer the lowest recurrence rate but require longer recovery and carry higher post-operative pain. So, excisional technique in case of hemorrhoid pain management, post-operative pain management is very crucial. Advanced surgical alternatives in hemorrhoids management, staple hemorrhoidopexy and transanal hemorrhoidal dearterialization. Staple hemorrhoidopexy, a stapler gun used and the hemorrhoid tissue excised and the cut end of the anal canal stitched simultaneously. And as the transanal hemorrhoidal dearterialization meaning suggests that it's an minimal invasive procedure, the transanal hemorrhoidal, the artery, the feeding vessels is dearterialized. Doppler guided suture ligation of feeding arteries, preserve tissue, minimal invasion. What is the advantage of this minimal procedure? Minimize pain, no formal excision, significantly lower post-operative discomfort, shorter hospital stay, faster return to normal activity compared to open excision. Tissue preservation. Transanal hemorrhoidal dearterialization targets the arterial supply without removing normal tissue with the help of ultrasound Doppler that identify the feeding vessel and ligate it. A tailored approach, match grade to intervention, diagnosis dictates treatment, severity guides the appropriate pathway. The treatment protocol is basically according to the grading of the hemorrhoid, either it is conservative or surgical intervention that need tissue excision of the hemorrhoid. Patient education, lifestyle modification and long-term adherence are essential for success to reduce recurrence and prolong the improved symptom of the patient. Lifestyle modification, that is non-medicinal management, dietary management, proper hydration, and do not seek prolonged or give prolonged staining during defecation. These are the basic long-term. This behavior must be continued to reduce recurrence or the condition come again. Exclude malignancy first. Always rule out colorectal cancer before initiating surgical management in case of hemorrhoid. Exclusion of colorectal cancer always done in case of rectal bleeding and before starting management for hemorrhoids. Thank you. We'll discuss more about hemorrhoid or other anal canal, that is anal fissure or other thing later. It's basically give some idea about hemorrhoid and what are the basic management and how the grading of the hemorrhoid help to manage to give the to make the protocol. What are the management must be given should be is basically depend on the grading of the hemorrhoids, either grade 1, grade 2, grade 3, grade 4. We offer conservative or surgical intervention. That's always management protocol depend on the grading, and always exclude malignancy before initiating management for hemorrhoids.